I'm Jorge Delva from the University of Michigan, and it's my pleasure to introduce Dr. Brigit Carter, who is assistant professor at Duke University School of Nursing. She is the project director of the Academy for Academic and Social Enrichment and Leadership Development for Health Equity, also known as the Health Equity Academy. And I've had a chance to look at her presentation already. We're up for a really nice treat today. Welcome.
Thank you. Thank you so much. I'm truly honored to be here today, and I was saying anytime I get an opportunity to talk about our program and to get more people involved in reaching out to explore these types of educational opportunities for our students, I welcome it. I have no conflict of interest to report, and I also have to acknowledge HRSA, Nursing Workforce Diversity Grant that sponsored this program, and Duke University School of Nursing, because as you know, without organizational support, none of these programs are really sustainable in a way that's meaningful. So today I just want to describe to you about our components, and then I also really want to get down to the nitty-gritty of why we're here and how we've really come to understand better how to extract social determinants of health from our students, and then also enabling them to better understand their population. So I'm just going to tell you a little bit about the two components, our pre-entry and then our pathways to success, and then I'll talk about how we address the social determinants of health for our students. These are our two components. I'm going to go into each one of these in detail a little bit more. So for the PIN component, which is our pre-entry in nursing, immersion in nursing, and that's the part of the program where they come to our campus for 6 weeks experience, and we really want to begin to address some of the things that we know are barriers for underrepresented minority students. One of the things that we know when students lack leadership development, team building skills, that often is because they didn't have a great deal of socialization when they were either in their elementary schools or in their high schools or even a previous college educational experience. When we go to HBCUs, we tend to think that we're going to have all these rich experiences, but what it does is sometimes makes them one of the number, and actually the majority are the ones that seem to get the richer experience when attending some of the HBCUs, because then they draw off of the richness of the students. So we really have to begin to address that. So what we do is bring them in, and these are just some of the components, but we try to have them take part in meeting nurse leaders, really getting an understanding about their stories. So we make sure that the leaders don't just kind of say, oh yes, I am the president of Duke Hospital. I want you to tell them their story. And the amazing part is most of their stories are from, I'm from a very rural, small town. I was very poor. So it enables them to see that this person is somewhat like me and that I can achieve these goals as well. We have seminars. I have seminars weekly, so I'm not only the project director, but I'm the academic coordinator, so I give them weekly seminars on Mondays, and they have various different components that we talk about in terms of having strategies, learning how to develop as a leader. They take the Kersey sorter so we can get an idea about their personality, their leadership style. One of the things that we do is, and I know it sounds small, but an etiquette and networking dinner. The etiquette portion is because as leaders, we find ourselves at the table many times with a fork and a knife, and sometimes many forks and many knives and many glasses. And we really want them to be comfortable in this new environment that we're placing them in. So they have a very formal networking and etiquette session. It's a 4-hour seminar, and then our alumni funded a dinner at one of our prestigious hotels, the Washington Duke Inn, which is very lovely, and they set a 4-course dinner for them, and they have to actually learn how to set the table, use the silverware, proper etiquette styles, and they all comment about that. And of course, having our alumni support that, again, it takes an organization. Journaling and reflecting and self and team evaluations. And the one thing I like about the journaling and reflecting, I was talking to one of my scholars who will be graduating in December, and she said, I just was looking at my journal from the summer, and I realized how much I've grown. And so that's a very important part for them to continue to look back on where they've come from and how far they've developed. The team building, there's oftentimes when people don't know how to deal with community. So the team building skills are very real, and they come in a very honeymoon stage, and we make them live together. So they have roommates of people that they don't know. So they definitely come in, and I love everybody, and then the next thing we know, they're storming. So, you know, we expect that. We're ready for that, and we help them get through that phase. And mind you, this is 6 weeks, so this is like on hyperspeed. But they do get through a lot of the storming. They don't actually complete all those phases, and we have to finish up when they come back and matriculate into the program. And if they don't matriculate, we still have avenues for them to join us. Communication skills, social emotional intelligence, we have a lot of seminars for that, and then improving confidence, self-esteem, and self-image. And a lot of that is just built around all of the components that they have to do when completing. We have a specialist who is a consultant for our team building, and she does a wonderful job of extracting these components from our scholars. And just the socialization part, currently we have a professional nursing course that they have to do. We want them to begin to grasp the identity of the nurse. We do send them on shadow experiences, hopefully in places that they're interested in, but they have all of Duke Hospital to explore. They have a faculty mentor or a staff mentor. We have some amazing staff at Duke School of Nursing. They do have a peer mentor or either an alumni mentor, and we do a lot of round tables, so they have expectations. The guided pathophysiology is also kind of it's very embedded in social determinants. I don't know if, I'm sure you know of unnatural causes, and we use those video vignettes a lot so that they can begin to understand what they're looking for, and then not just on, hey, I have this history in front of me, but now we've got to go back to genetically and look at the pathophysiology behind what has brought this person to where they are. And then we assist them in transitioning into our accelerated Bachelor's of Science in Nursing program. Now, this is the part I know everybody wants to hear. It's about social determinants, so I hope I was moving through quick enough, and you're going to have to give me a warning. So the pre-entrance webinar we do just really briefly introduces the program to them. We want to warn them because this is a very rigorous program, and we don't want them coming with the misunderstanding that they're coming to relax for 6 weeks and just get to know Duke University School of Nursing and our campus. They are really working when they get here. And we also have them work in ways that is very emotionally draining. So we want to warn them about that. We want to tell them the types of assessments that they'll have to do and how our social workers and how our consultants work closely together to help them understand their own social determinants that they bring when they enter into our doors. So they do a social determinant of health individual assessment. And this we find is very important because if we don't understand what our students' needs are, they can never understand or help another person. So we feel like it's important for us to address what they come to us with. We've had students who have had various issues in terms of just, I have a baby to take care of, I'm sending all of my money home to my parents and I don't have any food to eat. So the questions that we ask are are asking about their income level, and this is historically, so I'm not asking what your income level is today. It's when you were, as you were being raised, on this ladder, where do you see that your parents' income may have been? So did you feel like you were poor? Did you feel like you were in between? Or did you feel like you were very rich? We ask about their family's educational background. We ask if they have siblings, how far educationally did they get? We ask about their environment. We ask about crime. We ask if they were worried about any particular things. We ask them how they deal with stress, or how they even identify if they are stressed. So it's some very personal questions that we ask. We have a social worker on standby to debrief with these students after this, because it really extracts some very sensitive information. And most underrepresented minority students are very wary about giving out personal information. So do we believe that we get every single thing on this assessment? Absolutely not. But this is the purpose of us following up. And if we just let them go after that and say, oh, thanks for that information, but we have to follow up because this is just initial. They do the individual and group sessions with the social worker. So the social worker tries to work with them to identify additional social determinants that are impacting these students that they were not willing to discuss on the survey. The surveys, we initially were going to do them on computer and have them do ahead of time, but then we really felt like it was too sensitive to leave them alone and not have any support if they wanted to talk about feelings that may have extracted as they completed it. After we do the assessment, we do a prescription for success, and that prescription is based on some of the components that they talk to us about. So if they have problems where they felt like that they have issues with low self-esteem, or if they have issues with finances, which almost all of them do, if they have issues with childcare. So we develop goals for them. We develop strategies for them to overcome the barriers that they've identified. And then we have a follow-up plan, because, you know, just because one thing has been strategized doesn't mean that it's not going to reoccur or come up in a different way. So these are components that we continue to follow at 3 months, 6 months, 9 months, and 12 months, and then on exit. Now, mind you, my door is always open, and it's always a scholar standing in my door. So it really is an ongoing process. So you have to be willing to be open to listen to the students. The seminars that we have, well, first we do a pre and post test, which is really just kind of a basic test to see what is your understanding. Do you even know what social determinants are? You know, we know what the words are, but when they come to us, a lot of them don't know what the words are. And they were just like, I just wanted to do a summer program. You know, so, we really have to make sure they have a really good understanding of what social determinants are. And when we do our seminars, they get a lot of introduction to it, just kind of PowerPoint style. And then they also, as I said, the introduction to pathophysiology of disease related to social, environmental determinants of health. I know that's long and winded, but that's our guided pathophysiology course that helps them really kind of pick out what those social determinants are as they're viewing some of the vignettes or going through some of their pathophysiology courses. The windshield survey is a little bit more personal. They do an introduction to this, so they learn how to do a community assessment and a windshield survey. And this is something that they typically would do in their first semester anyway in nursing program. But we just make sure that the other students didn't have the ability to go out into the community. So yes, I got in my little white van and I drove them around to the communities of which they selected, and they had to go out and talk to people and get to know people, find out about their environment. They walked around sometimes for miles to see what was in the area. And they wanted initially to do a comparison of a neighborhood that was impoverished versus a more well-off neighborhood, but they decided to kind of focus in on this one neighborhood that they felt had been gentrified. So it was very interesting because we did that particular community assessment. We used that community the year prior, and it didn't look anything like it did when we walked in there. It was amazing, the transformation. And so they went to talk to the community and find out, hey, you know, they're building all these new homes in your area. Are you able to move into any of these? And a lot of them said no, but then a lot of them said yes. And when I couldn't move, but they did fix my house. And so they were able to really get a grasp of what changes like that happen in a neighborhood, what the impact is on the community. But it didn't make any changes in their access. It didn't make changes in their access to food because the grocery store that was there, the closest one, was a very small convenience store with very poor fresh fruits and vegetables. And even the grocery store that was close had rotting food in it. And so they were devastated. They were like, well, where are they going to go? You know, I'm like, okay, so that's your next step. That's your mission now, to figure out where are they going to go and how are they going to get there. The community engagement part is having them work closely with some of our partners, which are, one is CARE, which is in Durham. It's headed by Sharon Elliott Bynum, and the Durham Rescue Mission. And then also the Partnership for Healthy Durham is another one of our partners. And this really helps them engage, again, with the community. So they go to the Durham Rescue Mission, they talk to homeless women, they talk to women with children, they talk to single women, find out why they're there, how they got there, what it's going to take for them to get back on their feet. They need to just really see what this means. It's not just hearing stories, but seeing how it impacts people's lives. Again, the journaling, reflecting, and of course budgeting is extremely important, just because they come to us most of them with financial constraints, some from poverty, and then you give them money. And even though you're giving them a stipend to help them live, but they don't know how to manage it because they've never had money in their pocket before, not where I can say, oh, I've had this amount in my pocket every single month. And so we watch them very closely and guide them. If I notice that they're coming in with new handbags, you know, new shoes, you know, it's real. I have to ask them these questions. So are you budgeting your money correctly? Because I'm not giving you money to support a shopping habit. I'm giving you money so that you can live, so that you can have the right food. Someone talked about nutrition. I was jotting so much stuff down because that's something we focus on. We have students in our program who are hungry. We had to do a food cabinet because we had students who did not have enough money for food. So I think that people may say, wow, that's at Duke, are you kidding me? But, you know, I bet you it's at every institution. You just don't know. So we have to start to ask those questions. But it is very real about the budgeting. These are just some pictures of the students. They did some Habitat for Humanity. I make them do volunteer service as well. I don't have to make them because actually they went and picked their own. They were looking for opportunities, and then they're in their scrubs at going to a shadow experience. The scholarships is the biggest thing that we have encountered. Financial has always been a struggle for any school, you know, not just because we're Duke University, although that does have an additional impact. providing students scholarships and the ability to afford education is very important. We talk about social determinants. We got to go back to our students, guys. We can't just talk about what's going on with our population. If your students aren't being helped, then they don't know how to help your next group of people. When they go out into the community as nurses and doctors, they will not know how to do it. Nobody even talked to them about their own. Or even if they find someone, we were talking about this earlier, there may be a trigger. You know, I may have had a sexual abuse experience, and now I have to go in and help this person who's been sexually abused, and that has just absolutely triggered me in a way that I had no clue that it would. And now I'm here helpless myself, and I cannot help this person. Finding out those issues so that you can help a student deal with those, getting them the resources that they need so that they can be effective providers is what I believe is the importance of what we're doing right now. Do I feel like I need to build off of this? Absolutely, that'll be my next grant. But definitely this is the beginning portions. And of course, as they go through the pathways to success in nursing, we provide them with the academic and social support. It's about staying there and making sure we're meeting their needs. You know, they struggle academically. A lot of these kids come from colleges and they've had pretty good GPAs, but I'm not quite certain. I have seen some writing and reading skills that were below par, and I'm not quite sure how they got out of college. And they got out doing well. So these students didn't come out with below 3.0 GPAs. These had 3.0 and above. Most of them, to get in our program, have to have a 3.4 and above. So one of the things that we did was to really try to help them enhance their skills, use the editors, so that they would be able to improve their writing skills. The other thing that we do is I open my home once a month for Sunday dinners, and it's really just a time for them to feel that they're cared about. That's very important. For our underrepresented minority population, socialization is a huge problem if they don't have that sense of community. So we really want to provide that for them. And they continue to meet with their social worker. Post-graduation, I tell them always they can't get rid of me that easy. So we make sure that we continue to monitor their progress. This particular cohort will graduate in December. All of them are very interested in working in underrepresented areas with low-income populations, and I find that extremely admirable. All of them want to further their education, so I figure we've done, you know, part of our job right, at least. So they're moving on. I think we've talked a lot about this, but I just really wanted to talk about how important it is to make sure that it's not just what we do in one little program, but also infusing it into your school. One of the things that I feel very fortunate is that we have a faculty who really understands the importance of students knowing about social determinants of health, and not just knowing about it, but like, how do we really get them to understand how to get this information from patients? That's the difficult part, because our encounters are so short. And so we really have to make sure our students understand how to therapeutically communicate with a patient to get the information that they need so that they can provide them with the resources that will be effective in helping them transition either to discharge to home or into another situation. So when they enroll, we just want to make sure that they get those classroom experiences. Our curriculum was just redesigned, so we're going from a wellness to illness, and it's across the lifespan. So they do a huge first semester. We're talking about the whole first semester is focused on wellness, and they really get a deep dive into how to do community assessments, how to engage and understand what wellness looks like. and all of those background in social determinants of health. Each one of our components of our program have a piece of social determinants of health, so it's not just once a semester. Every course has objectives that address social determinants of health. It's weaved through our entire curriculum. And one of the things we were talking about evaluation, I heard that question come up. And so the way we evaluate it is to have our students do simulations. They do it at their second semester and at the end of the program, which theirs is coming up in November, and we have a rubric in how we measure whether or not they have an ability to extract the information from a patient, and albeit a simulated patient, if they have that knowledge over the time. Now, we did it at their second semester, and they were pretty weak, so they need to be stronger by the time they get to this fourth semester. That's the goal. A lot of them, they knew what to ask. They were just too scared to ask. And I think that happens a lot with healthcare providers, being afraid to ask those sensitive questions. This is just one of my students. She likes to draw, so I wanted to, and she loves talking about social determinants. So. And again, this is, like I said, in our curriculum, this is what we believe is we have to integrate these concepts of determinants of health, levels of prevention, and cultural competence into the nursing process across all populations. So that's how we address it in our curriculum. And then also what I feel like is important to say is it's not even just our curriculum, but it's our whole community at Doosan. You have to also get everybody on board, because it's not just a one program thing. You know, these students are going to be the same students that will come out and go to your master's programs or your PhD programs. I just also wanted to say we did 6 colloquiums focused on health equity or social determinants of health, and we invited the communities across campus, and it has been a wonderful infusion to begin the process to help people understand, how do I address it in my curriculum? You know, what is it? What do you mean, racism? So beginning those discussions, and now School of Medicine is picking it up and having conversations on race and all these other inclusion and diversity conferences. So. All right.
Thank you, Dr. Carter.